And right now, the director of the Michigan Department of Health and Human Services is joining us live for 7 UpFront. We thank you for being with us, Elizabeth Hertel.
Good evening. Thank you for having me.
Well, just last week, the CDC identifying Michigan as the biggest hotspot for COVID-19 in the country. What do you think is driving our surge of cases?
Well, our weather has started to get cold, so people are gathering more indoors. And I think many people just need to be reminded that COVID still is out there. We are still dealing with it, and to stick to those basic public health mitigation practices: frequent hand washing, use of hand sanitizer, wearing masks now if you're indoors with a group of people, social distancing. We're seeing those increases in COVID, but we're also seeing increases in other respiratory viruses that are transmitted the same way as COVID.
Several school districts in Metro Detroit and across Michigan, they started Thanksgiving break early because of COVID concerns. And just today, we learned 140 new school outbreaks as we see more of this spread. What are health department's guidelines for celebrating?
We really want people to be able to enjoy the holidays with their loved ones in ways that they were not able to last year. And we know that many people in the state of Michigan are fully vaccinated, and many more have begun their series of vaccines, either with Pfizer or Moderna. So we encourage everybody to get vaccinated. Get your first shot if you haven't, finish up that series if you've gotten it, or get your booster shot if it's been 6 months. If you're gathering with people indoors who are fully vaccinated, enjoy the holidays. No need to worry about masks or that sort of thing. If you're with people who may not be vaccinated or may have be immunocompromised, be cautious. Maybe wear masks inside would be a good idea. Be in an area that's well ventilated. While many of us probably don't want to celebrate Thanksgiving outside, crack a couple of windows, get some air moving in there, and make sure that you're frequently washing your hands and disinfecting high-touch surfaces.
Well, we've been hearing and reporting that hospitals are filling up. It's leaving some health systems bogged down yet again. What is the plan if hospital reaches capacity?
We're really concerned. I am personally very concerned about our healthcare providers and our hospitals across the state. They're very tired. They've been committed to caring for those in their communities for a really long time during some very difficult times. They are filling up again, and the concern isn't just their ability to take care of COVID patients, but all patients. And if the hospital is full and there's a car accident, they may not be able to take care of the individuals in that accident, and they'll have to go to a different facility. So at this point, we're working closely with the hospitals to understand how we can support them through additional staffing resources, how we might be able to support them in increasing their use of monoclonal antibody therapy for people who do have COVID and are eligible for that, and ensuring that they do have the tools that they need to continue to take care of their communities.
Do you expect the new mask advisory to help at all?
I certainly hope so. It's easy for us now, this far in the pandemic, to move on with our lives and kind of not pay as much attention because COVID may not be at the forefront like it was a year ago. So just a reminder to everybody that not only is COVID still here, we are at a very challenging time right now, experiencing a fourth surge. We've seen a great spike in cases and those hospitalizations. So continuing to be cautious and deliberative about being out in public, being around others, and trying to protect yourself and those in your community from contracting COVID.
All right, Elizabeth. Well, we thank you and hope you have a good holiday and celebrate peacefully, and we'll try to do our best to stay safe.
Thank you so much. I appreciate it.